Hi, my name is Rachel Horton, and today I'm going to talk to you about attention deficit hyperactivity disorder, also known as ADHD. I will be going over the current research that presents the signs and symptoms of ADHD and how those symptoms help with diagnosing a child, the treatments of ADHD, and the learning troubles that follow these diseases. Overall, I will be answering the question, what is it like for a child with ADHD? Attention deficit hyperactivity disorder is a common neurobehavioral disorder that occurs in about 2 to 18% of children. The main mechanism involved in ADHD is a breakdown in motor skills. There are two main classes that define this disease. They are inattention and hyperactivity or impulsivity. The signs of these two classes can be noticeable as early as 2 or 3 years of age. There are many signs of inattention that are noticeable to others. Some of them are when the child can't focus on schoolwork. They have a lack of continued attention and have a lack of attention to details. They are often poor listeners. They fail to follow basic instructions and also fail to follow through on certain tasks. They often avoid tasks that require continuous mental effort. They are easily distracted, and they often lose things and are forgetful in everyday activities. To be diagnosed with ADHD, a child has to show significant elevations in at least 6 of those 9 inattention symptoms. The signs of hyperactivity or impulsivity are much different. They are often squirmy or fidgety. They climb things at inappropriate times. They answer questions before the person is finished asking. They talk excessively and often have trouble with quiet activities. They are usually very on-the-go children and have trouble sharing and waiting their turn. Like inattention, to be diagnosed with ADHD, a child has to show significant elevations in at least 6 of those 9 hyperactivity or impulsivity symptoms. Now I will be talking about the treatment for ADHD. If 6 out of 9 of any of the previous symptoms are seen repeatedly, a parent can take their child to a professional to have the child evaluated. The child may be prescribed to medications such as Ritalin or Adderall. However, it is difficult when diagnosing a child because doctors have to rely greatly on reports from parents and teachers. It is also difficult to diagnose ADHD in young children like toddlers and preschoolers because studies haven't directly examined the age at which diagnostic assessment can predict later ADHD. It's very hard to predict later ADHD when the child is still at such a young age. This is why oftentimes the best treatment can actually be done at home. Evidence shows that eating a healthy diet, getting a lot of exercise, and making other smart choices will help a child best manage their ADHD symptoms. For example, exercise is a great treatment because physical activity immediately boosts the brain's dopamine and serotonin levels. As far as eating habits are concerned, adding something like more omega-3 fatty acids to your child's diet will help. Studies show that omega-3s improve hyperactivity, impulsivity, and concentration in kids. Omega-3s are found in things like salmon, tuna, and sardines. Now I would like to talk about the difficulties that children with ADHD have with learning. Formal learning disabilities are very common when a child has ADHD. Some of the disabilities are that they often have co-occurring language problems and they have both expressive and receptive language delays. They often have delayed onsets of work and perform poorly on tests, and they also have more trouble in mastering basic academic skills such as those in math because they are less able to automatically process information for certain tasks. ADHD is also associated with an ineffective use of memory strategies and a failure to sustain effortful processing over time. However, the most common learning disability for children with ADHD is having a reading disability. I hope that my video was successful in teaching you a little bit more about the life of a child with ADHD.